if our entire COVID testing system is on the wrong track, ineffective at finding contagion and stopping the pandemic? 9 of 10 infected people never show up for these deep penetration nasal tests, and the tests don't differentiate between people who are positive as opposed to still contagious.
Tilt your back just a bit. Perfect.
Back in July, Bill Gates said the entire North American testing system was garbage because of the delay in getting a result.
All these numbers about how much we test, the majority is just complete waste. You need to get it back as soon as possible so that somebody can change their behavior so they're not infecting other people.
I think that ultimately at the moment we have a testing program that is almost useless.
Harvard epidemiologist Dr. Michael Mina has become the leader of the opposition to our existing testing system. He says we should test many more people to find those who have no symptoms but are contagious.
We know that we miss somewhere around 90% of all infections altogether. And then amongst those cases that we actually capture and find as positive, we're generally finding them too late in their course of infection.
This is the alternative that Michael Mina proposed last spring, a simple, cheap paper test that can be completed at home.
So actually underneath this plastic is just a piece of paper with the actual test materials on it.
It takes 5 to 10 minutes and would show a line if there's a positive result. He says this will stop people with no symptoms from walking around while contagious.
You know, I keep hearing from government officials that the science is just not ready. These home tests are just not accurate.
They actually are very accurate. They can achieve sensitivities in the high 90 percentile.
So why would a home paper test be better at stopping the pandemic?
The convenience of testing is a very important part of public health. How it works then is that if we have enough people who are frequently testing, then we have a very good shot at finding a lot of people who turn positive, say in the first day that they're potentially transmitting virus.
So even though a home paper test would be perhaps less accurate than a PCR test, it would be more effective at stopping the pandemic.
That's exactly right. So we've been so focused on the accuracy of the test that we have completely lost track of the effectiveness of the testing program.
Michael Mina's home test crusade has been supported by Boston University economist Lawrence Kotlikoff, who says the idea makes financial sense even if someone is testing themselves every day.
It probably will cost $1 a day per person at the end after we really mass produce these rapid home tests. And that's $365 a year. That's peanuts compared to the annual wages that an average American worker earns, which is more like $55,000. So this, on a cost-benefit analysis, this is a no-brainer. This is a way to save the economy at extremely low cost.
Governments in the United States and Canada have been taking baby steps towards rapid testing. Last March, the U.S. introduced the Abbott ID rapid test and started using it to test all White House visitors. The test needs to be administered by a medical professional using an expensive machine, far more complicated than a simple home test. The Canadian government finally authorized that test last week, a 7-month delay. Now there is a Canadian company ready to produce a rapid test once they get government authorization, the Arsenault Nanotech Lab in Dartmouth, Nova Scotia. CEO David Regan says this test gives results in a few minutes.
So if you can do more testing, even if there's a lower sensitivity, there's a greater impact and a greater possibility of suppressing the pandemic.
The Nova Scotia test has not yet been approved, but this week Health Canada did approve a similar American test that also can be done in doctors' offices and pharmacies, but not at home.
The work that Health Canada is doing is both on the accuracy of the test within a certain parameter when they're assessing any kind of rapid test, but also working to understand how that test might be used.
If you can catch 70% of people with a less accurate test that's more deployable to many more people, that's much better than capturing only 5% of people with a very, very accurate test.
Remote Indigenous communities are in serious danger during a COVID outbreak because of often overcrowded living conditions. But now testing there often takes 2 weeks to get a result. Indigenous health doctor Anna Banerjee says home testing would be a game changer for Canada's north.
That will help public health react appropriately quicker. So I think that there's a big, that can be very useful compared to the current way things are done in Indigenous communities.
So if you were able to put this in effect very quickly, how fast do you think it would shut down the pandemic?
If 50% of a population was using one of these tests every 3 days and 10% of the tests failed, we think that they would still be able to get outbreaks under control in about 4 to 6 weeks.
Last Monday, the U.S. government introduced a new home-style test called the Abbott Binax Now.
Into the test, twisted 3 times.
The U.S. will distribute 150 million such tests. Will there be another 7-month wait before a COVID home test will come to Canada? Terence McKenna, CBC News, Toronto.